the experience. So to recap, she went through a tremendous, huge traumatic injury inside a car that literally in the accident had 2 fatalities.
One fatality.
One fatality.
Yeah, the other.
Okay, and everybody in their car is fine.
Yes, in the car she was in. Yep.
They were in Sheena Hot Springs driving.
Yes, yes.
So they're at least going 45.
Yes, yeah,
And so they got like kind of a head-on collision.
yes, yeah.
And so she had the brown urine right after the accident, but was eating and drinking fine.
Yep.
Yeah.
And that happens because bladders can get beat up too, and they bleed for a little bit, and then if they clear up and they're fine, then they heal fast.
Yeah, which it did.
So sometimes they pop out, and they can still walk with a
Okay.
dislocated hip, but
Yeah.
it will swell.
Okay.
And so what we need to do is go ahead and to get good hip x-rays, we're going to have to knock her out, see what's going on. Now what'll happen, if she's got it, I can feel crepitation
Okay.
in that hip. It's going
Oh, okay, all right.
kind of go, don't do that.
Yeah.
I mean, hips are okay. When they get dislocated and pop that little tendon out, what we have to do is we can't put that back in. We just rip the joint capsule that contains and holds that all in, plus the major ligament that holds it in.
Yeah.
When that pops and does that, we can. I'm not God.
Yeah.
Some days wish G would let me play God once in a while, but I can't put it back like that. But what we do is we know that because the dogs walk like this and their gluteal muscles are like this, that we can go ahead and actually cut the femoral head off of that bone. And because the muscles are like that, she creates a false joint, and there's no arthritis, because if we leave it like it is, we'll get bone on bone arthritis, and that's painful. So the whole function is to go ahead and stop the pain.
Okay, yeah.
So let me get you a little demonstration with a hip so you understand what I'm
Okay,
doing.
okay.
This is my friend. So a hip is in that ball and socket joint like that, and there's a little piece of elastic that's holding it in now. But what's happened to her is I think that got popped, plus there's a little joint capsule that's all around that. And when that tears, it's like really tough. You've done moose hunting and all that stuff. I mean, it's tough. And if you try and just pop it in without that ligament there, it'll go ahead and it sucks the joint capsule down in, and it gets hit nasty, and this is what happens.
Okay.
So when you do hip x-rays on dogs, you have to have them knocked out, because these hips have to be all the way back, and unfortunately, they have to be very still.
Yeah.
So we just quick do that, take the x-rays, make sure what I'm feeling today is what is really happening,
Yeah.
and then we go right to surgery and take that femoral head and neck off.
Yeah.
The incision will be about that big. I'm a plastic surgeon too.
Okay.
She won't even know it. And it's a shave will come back, but we'll put her on a bunch of pain pills.
Okay, yeah.
I'm gonna put her on pain pills right now, Rimadyl, little Tramadol, and then we just go ahead and
Yeah.
she'll be okay.
Okay.
Hips are very important in dogs. Sometimes this happens naturally because of genetic fallbacks, where they have hip dysplasia and this joint's really nasty and rubbing all over the place. Instead of having a cup with a ball, you have a saucer and it does this all your life, you're gonna get this too. But for her, because it's traumatic, we have a couple options. So you wanna take care of the hips of your dog. So after examining Myra and really twisting her hip where the swelling was, I can hear. I'm surprised she wasn't screaming. I would be. But I don't want to do any more than that. I want to get some x-rays, figure out what it really is, make sure I'm right, and then fix it.